Hello, listeners. This is 21 Days of Cancer Awareness from Increase. Today, we will be listening to a survivor of breast cancer in the passing of Dorothy Nuhu Akinova, the Executive Director of Increase, tell us her story and her journey fighting breast cancer. Please introduce yourself, Ma, and tell us a bit about breast cancer and how your journey fighting breast cancer started.
Hello, listeners. My name is Chesamilo Dorothy Nuhu Akinova. I knew that I had cancer 10 years ago. It was in December 2010. The journey began on the night of the 7th when I came back from work, changed into a white t-shirt that eventually I noticed was stained with dark brown discharge from my nipple. Once I experienced that, I knew that it was a potential danger that I was in, because I have been part of the community educators around the country, creating awareness on breast cancer. So I knew that one of the signs that the breast may present to show that there is cancer growing in it is the dark brown discharge from the nipple. I started that journey that night. Breast cancer is the abnormal growth of tissues within the breast. They are abnormal because they just keep growing. They don't die. Now, the important thing is to discover cancer cells or cancer growth early. There is a slogan that has been used around Nigeria frequently for awareness that says, "Early detection saves life." Yes, if it detected early, in fact, there is possibility for cure. Unfortunately, most people procrastinate. They are overwhelmed by the news, and they don't aggressively pursue the right cure, medical treatment. And before they know it, the cancer has moved from the stage 2 to 3, from stage 3 to 4. And when it is at stage 4 especially, that's when people start panicking and coming to the hospital. If we discover early and promptly commence treatment, medical treatment, we can deal with breast cancer. Now, what are the signs that a woman can see that show that there is cancer in her breast? So we are told to do breast self-examination. It's a process where the parts of the breast are felt meticulously with the palm of the hand to feel whether there is something like a lump in the breast. The lump can be the size of beans or corn. If indeed we feel any lump in our breast, we should report to the doctor. The presence of the lump does not conclude that the person has cancer. That lump needs to be removed and examined. And it is only after that examination that doctors can confirm to the woman whether the woman has breast cancer or not, whether the lump that was removed is malignant or benign. The other sign is the thickening of some part of the skin of the breast, or looking reddish. When it is thickening, it does resemble the orange peel, the back of the orange peel. If a woman examines her breast and sees that, she should immediately see a doctor. Breasts have a nipple pointing out, but there are times that when there is cancer in the body, the nipple is pulled in and is beginning to look like a dimple. If a woman observes that, she should see a doctor and report immediately. The other sign, like the one I saw, is the discharge from the nipple, and the discharge is not clear like water, is not white milk, but dark brown in color. If a woman sees that, hospital. Sometimes a breast may just suddenly grow bigger, by far bigger than the other one, or it may grow smaller, by far smaller than the other breast. If that is observed, please see the doctor.
Thank you very much for that, Ma. What did you do after learning of your diagnosis?
What did I do after seeing or learning of my diagnosis? Reaction to a diagnosis like that is in different stages. There is a stage of shock, there is a stage of, denial, there is a stage of sadness, there is all those different stages. Some people may, there is a stage where they may lose hope, given the kind of stories that go around regarding cancer. These stages can occur in one day in people who are adequately informed and who have life competency skills, including problem-solving skills. So as soon as they experience the shock, then they start taking steps. Oh, okay, so how do we solve this matter now? Okay, so in some people, it can be all spread out over weeks or even months. And some of these experiences in mood changes can be reoccurring even along the weeks, the months, the years of treatment. And so when I learned about mine, I felt like the clock just stopped. I broke into sweat, and I went to wake my children up and tell them that this was my observation. And from the way we've been giving the education to women at community level, it is a sign that there may be cancer in my breast. So I was going to go to the hospital to see a doctor in the morning at daybreak, so that they can tell me what to do. I then